Hello, my name is Kathy, and I am your physical therapist who also lives with MS. Today I want to help you get the most out of your next PT visit, so let's dive right into it. What should a PT do for you when you live with MS? Physical therapy is super important. In fact, we'll go way back to 1997 when I started PT school and I was getting a master's. So I decided to do a master's thesis, which you had to do by yourself, and you had to defend it in front of your professors at the end in order to graduate. So what was my thesis topic? Physical therapy and MS. And this was back when no one could tell I had MS, because even though I was on a MS medication and I was diagnosed, you couldn't tell because my symptoms weren't huge, but they were also invisible. Even my classmates did not know. My professors, unless I told them, could not tell. This was a really important thing for me to, as a PT or a student PT, trying to figure out why is it important. Doctors probably should send a patient to a physical therapist right when they're diagnosed, even if they don't have a lot of symptoms, because that education part is gigantic. You need to be educated on exercise, why it's really important for people with MS, even without a lot of symptoms yet. If you're already a person who exercises, great. How do you modify that as you go on in your experience with MS and as you progress or not progress? Nowadays, a lot of people get diagnosed more quickly, and there are lots of great medications out there to slow progression. So people who are diagnosed now are going to have a very different future than people who were diagnosed when I was back in the early 90s when there was one medication. As a physical therapist, I feel my job is not just to teach you about exercise, but also to cover other issues and be able to make recommendations about referrals, whether it's to a urologist or a physical medicine and rehab for movement management like spasticity, to a dietitian. I'm not a dietitian, but eating well is very important, even without MS, but more importantly with MS, which is a disease that can, I think, help be managed, not just with medications, but also with diet. So referral to dietitian would be really helpful too, that we can give you. So all that education, even in the early stages of MS, is super important. Now, let's say you are a person who has been diagnosed for a long time. It's still very important to come to your PT. Your PT can help you manage spasticity. Your PT can help you do gait training with you, can help you decide when to go from one assisted device maybe to another to improve your safety, teach you how to use that assisted device more appropriately. So a lot of times patients will come to me and say, hey, I'm falling, but I just don't want to use a cane. I don't like the way it looks. I'm too young to use a cane, etc. That's true. And I would like to help you work on your balance and work on your strength and work on your coordination, so maybe you don't have to. But if you do have to, I want to teach you how to use it safely and correctly, because if you fall, you look a lot more disabled than you do if you're using a cane. And a lot of people have that image of, if I use a cane, people are gonna look at me and say I'm disabled. But if you're falling all over or you look like you're drunk, they're gonna think that that something else is wrong. So I think I'd rather look like I've got it together and using my cane or my walker and not falling than I'm falling, I can't leave my house, I can't socialize, I can't do this and this and this because I don't want to use an assisted device. It's a hard thing to get over. But with lots of talking and education and hopefully my help, I can help you kind of get to where you are more independent and safe and get to do what you want to do. And how often you should see your PT can depend. I don't see people more than twice a week at most, because it's a chronic disease. It's not something I'm going to be able to cure you of, right? We can't cure people with MS. We can just help you move better, be more safe, do what you want to do as best as we can. Also, it depends on where you live, how far away you have to come to see me, whether you have help with driving you. If you're not driving anymore, do you have a caregiver that can help you get there? If you don't, once a week might be the limit as best as you can. But what I do say is if you're coming once a week, and I'm seeing Ori once every 2 weeks, if you live really far away, you've got to really do a good job on your home exercise program between visits. We are educators. We are not personal trainers. What we want to do is get you to be where you can do this stuff on your own. And then you won't have to come back unless something else happens or some new symptom develops that you want help with. So you've got to be really good about doing your home exercise program, and we're going to try to customize it to what you need the best we can as far as where your weakness is, where your spasticity is, where your function is. So that's our job. What's the best way to prepare for a PT visit? That depends. If it's an evaluation, you want to make sure that you have the things that you need for that first visit, like your list of medications, obviously a prescription from your doctor, it's medical history, so we can kind of get the best picture of what's been going on, surgeries, maybe comorbidities, like you have MS, but do you have other things like high blood pressure or high cholesterol or osteoporosis, because we need to know that if you've got some fragility to your bones, diabetes, any other heart problems. Knowing all that background is really important. So come prepared with medical history, medications, dosages as well as what they are, including supplements, because supplements can interfere with medications, so we kind of know what all the stuff that you're on. And then, if you have a caregiver to come with you, if you're anxious when you have these visits and you want to have somebody there to be kind of your memory for you, that's really important, so you can get home and remember, what did she say? If I give you any exercises to do first time, have that person help remember those things. So that's kind of nice. So if I have a husband or a wife who has MS, sometimes they'll bring their partner along just to help them keep it straight, or else be their kind of also medical historian. Like for instance, I'll have a patient say, well, do you have any falls? Well, I hardly ever have falls. I might have had one fall this year, and the spouse will say, no, remember that time you also fell at so-and-so's house, or you fell outside at that restaurant? And they'll, oh yeah, so they can help remember some of that history, because that's really important to know what your fall history is. So make sure you can tell us that too. So those are some basic ways to be ready for a PT visit. Does a PT need a specific certification to help people with MS? That's a good question, but I would say no, with a caveat. Again, physical therapists are trained in all sorts of disabilities, medical problems. There are PTs that work in hospitals and see a whole variety of problems, whether it's orthopedic, neurologic, cardiac, etc. People in rehabs, people in outpatient centers. So there isn't necessarily certification from a physical therapy program, but people do tend to find their niche. Some physical therapists love orthopedic therapy, and they want to work with people with orthopedic problems like total knee replacements, total hip replacements. There are people who love therapy for people with neurological impairments, whether it's stroke or Parkinson's or MS or spinal cord injuries. There are people who love cardiac, heart rehab, people who have had heart attacks or heart surgeries. People like pediatrics, work with kids, people who like to work with geriatric patients, which can cover anything, right? Because it's just people over a certain age. So there's tons of different areas. People tend to kind of specialize because they're really interested in that. So I specialize in neurologic therapy because that's what I love to do. And so you don't have to belong to American Physical Therapy Association, but I do. There are a few benefits because you get online, you get more resources. And within that big APTA, there are small little chapters, and I belong to the neurologic chapter of the APTA. So I have like a listserv where people can ask each other questions about patients they're seeing online. Hey, I have this patient with MS, and there's a really tricky thing about it. Does anyone else have any ideas? So we can bounce ideas off each other with that listserv. So that's kind of nice, but you don't have to belong to that. It's not a certification. It's just something I do for more information. And a lot of neurological therapists will have that. They'll have memberships into more specific neuro groups. There is a certification called a MSCS, and it's a Multiple Sclerosis Certified Specialist. And that is through the Consortium of Multiple Sclerosis Centers, CMSC. So they're a big organization with a big conference every year. Great information, and all the people at this conference are people who are health providers, whether you're doctors or nurses or PTs or speechies or OTs or social workers who treat or see people with MS and have a special interest. And you can get certified through that, which I have done. There's also a special certification with the APTA called a Neuro Certified Specialist. It's not just MS, but it's specialized in neuro, and I have taken that test. So you can, and you don't have to go to someone with letters after their name about MS, but yes, go to someone who has a lot of experience with neurological populations. And it doesn't have to be just MS. It can be any neural population. Those are the people that are the best to work with people with MS. If you liked our conversation today and it gave you a bit of clarity or comfort, imagine having this kind of support built into your week. At MS Workouts, you're supported by a team that truly understands MS. Clinicians, exercise specialists, and people like me who also live with MS. Our steady-paced strength training, gentle recovery routines, yoga, and weekly live classes can help reduce anxiety, ease spasticity, and create a calmer, more predictable routine that often leads to better sleep. And because consistency matters, every member receives a personalized weekly success map that I designed for you. If you're looking for structure, support, and a way to feel more grounded day to day, we'd love to help. Just tap the link below to explore MS workouts and see how it can fit into your life.